You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Shawn Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. Ivan, please go ahead and get us started.
Hey, I'm Zach. Really excited about our guest today. We have Larry Heaton. He is the CEO and director at Zomedica. Mr. Heaton brought to Zomedica more than 35 years of executive leadership and operations experience from the medical device and biotechnology industries. He's an inventor on several U.S. patents and has served as a member of the board of several international medical societies and foundations, including the MITAC board for commercialization of NASA technology via partnerships with the medical industry. More importantly, he is a pet lover and grateful to be playing a small part in improving the lives of his pets and yours. Larry, welcome to the show. Thank you for finding the time.
Thank you very much. I'm delighted to be here. I appreciate the opportunity.
Can you tell us a cool thing about NASA? I immediately thought, and I apologize right before this comment, I think about Big Bang Theory when he was a part of the spaceship, but he was responsible for the bathroom. But I don't know if you know the episode. But what is the medical innovation that was brought to NASA, if it's not a top secret? And can you share that story with us?
Well, of course, the most famous is Tang, right? Which we all love, the little orange juice that isn't really orange juice. But with NASA, when I was serving on that board, the things that we were paying attention to were how do you provide healthcare on a rocket ship that's on its way to Mars without having a doctor and a nurse and an OR tech and so on and so forth. And so telemedicine, the whole idea of being able to, provide remote care was one of the first. This was one of the first drivers of that technology. In addition, once you get sort of out of range and you can no longer communicate real time, then a whole bunch of simulation technology so that you could actually have someone that was sort of broadly proficient in healthcare be able to learn remotely through simulations and practice that gallbladder they were going to take out or what have you. And then further, early development of AI, so that you could use AI assisted tools to be able to diagnose and to be able to guide therapy as well. Many, many more examples, but those are the ones I was most involved with.
Super fascinating. So, Larry, you've got quite the resume, and you've found your way to animal health. What excites you most about the work that you are doing at Zomedica, and why?
Well, I think the idea of being able to take care of patients that can't speak, that can't tell you what's wrong. I mean, we all know when something's wrong because we're close to our pets, but they can't verbalize. And so therefore you need to be able to gain insights into what's troubling them, what injury they have, what disease they might have, using diagnostic tools that don't rely upon patient feedback. And so for me, both the idea of being able to take care of the little ones and also be able to utilize technology that we've used in human healthcare, and maybe in some cases that are not yet being used in human healthcare, to provide the same level of care to our family members that are walking on four legs as we do with those that are walking on two.
Just for those folks that might not know what Zomedica is doing, and I know one of the things that was really cool that John Ayers, the previous CEO of IDEX, used to say, I really like that. He was saying that we're giving a voice to a pet through diagnostics. I really remember that. I had a great experience working with him, obviously before his injury, but I wish him recovery and all best. But what is it that Zomedica does, and what are those innovative, cool things that get you excited these days?
So we, in a nutshell, we bring innovative technology to veterinarians that help them do the things they really love to do, which is continually improve the quality of care for pets and the satisfaction of the pet parents. But we have an equal focus on helping them do the things they really need to do, especially in this environment, which is to improve their workflow and their financial status of their practice. Vets over the last decade have lost a lot of revenue as we began to buy products from Chewy and Amazon and Walmart, and all those are good things. But now the vet is absent that source of revenue. And then they were hard hit by COVID, both from the standpoint of many closed down and then came back. And then staff left and then didn't come back. And now they're competing for staff with McDonald's that's paying $18 an hour. And they can't afford it because they have that revenue gap. And yet 23 million pets were brought into US households during the pandemic. So you have a higher demand for services and yet fewer staff. And so you have to do more with less. And so at Zomedica, we're trying to do both things. First, help them improve the quality of care for their pets that they're treating, because that's their love, that's their passion, but also help them improve the health of their practice so that they can continue to do what they love to do.
That makes a ton of sense. So let's get into the weeds, shall we, Larry, a little bit. So talk to us about some of the innovative products that you guys have brought to the market since your 10 years started at Zomedica, and what they do and why the veterinarians that listen to our show should be looking into them if they don't already know about them.
Sure. So we'll start with our Pulse Vet shockwave technology. This is a device that introduces a sound wave into the patient, and that sound wave stimulates, it upregulates cytokine production. But what it basically does is it stimulates the body's own response to a perceived injury or perceived condition. This has been used in equine medicine for a decade or so. It's become really a standard of care. There's 40 clinical applications for it. And it was a great technology that was introduced, actually spun out of a human health company and then hit the market for vets 7 years before the company that spun it out was able to get approval to go into the human market. Tremendous results backed by a decade of clinical research, including randomized control trials. The recent innovation was that we developed a handpiece, it's an accessory to the system, that allowed for the first time for this technology to be used with small animals, dogs and cats, including kittens and puppies, without the need for sedation, making it available for the first time to mainstream small animal vets. This technology is brilliant. It can treat a lick granuloma with a single treatment, no need for retreatment. It can treat a partial cruciate tear such that you don't have to go to surgery. It can be used prophylactically on post-TPLO patients so that they don't have to do another TPLO on the contralateral side, and potentially prevent or at least delay the onset of OA or osteoarthritis. There's a study ongoing right now at CSU that's exploring that. If we use prophylactically shockwave, can we delay or prevent the onset of OA? So this is a tremendous product that not only improves the quality of care for the pet, but also improves the satisfaction of the pet parent. There are other devices that, if you look at laser, it's 10 to 15 treatments. If you look at other treatments, they may take multiple 5-6 times to do the same thing you can do with shockwave in 1 or 2 times. So that's a really tremendous therapeutic product that we provide. The Assisi Loop, used in human healthcare for many years. In fact, the first recorded use was Albert Einstein's cardiologist who used it on him. We have the only device that's used in animal health. And this is something that's sent with the patient to go home to involve the pet parent in that continuum of care. It provides a targeted pulsed electromagnetic field therapy, which reduces endothelial nitric oxide, which in turn reduces pain and inflammation. We've also got products, those products allow vets to do things they couldn't otherwise do. We've also got products that allow them to do things on the diagnostic front at a higher quality and potentially and certainly an improved workflow situation. So we just launched the TrueView microscope. It's a digital cytology platform. It's not the only one that's available in the market, but it's the only one that automatically preps the slide. So instead of the technician needing to put the blood on the slide and then smear it and then dry it, fix it, dry it, wash it, stain it, dry it again, and then after 5-10 minutes, put it in the microscope, and hopefully they got it exactly right. In our case, you simply put the blood on the slide, put the slide in the microscope. Your hands-on time is a minute, and you get a perfect image every time. And if you are satisfied with your ability to diagnose that condition from that slide, great. If not, you push a button, it goes to a pathologist, and you get a read within 2 hours. We have the VetGuardian product, which attaches to a cage of a post-op patient and wirelessly and continuously picks up temperature, pulse, and respiration and puts that on a graph to any browser that you might want to access, so that instead of having a tech watch the pet in post-op recovery, and of course, they don't have the staff to do that, and even if they did, they don't have x-ray vision, they attach the VetGuardian, which has thermal imaging, regular video, and Doppler radar, which can pick up those vitals. And finally, we have the TrueForma diagnostic product that provides esoteric, totally proprietary tests in the clinic at the point of care things that aren't available from the other larger company devices because of the unique technology that's involved in it. And anytime you can give a diagnosis, you can give a lab result within 10 minutes with your hands-on time only 1 minute. That's going to not only improve the quality of care, but also reduce the staff time involved as well. So we have a suite of products, and all sort of meet three criteria: improve the quality of care, satisfaction of the pet parent, improve the financial situation for the vet, and also are backed by clinical data.
That's really cool. I was just looking at it. I think, I'm not sure if I'm mistaken, but I think Vet Guardian is someone that we interviewed with the founder at some point, maybe before you guys acquired them.
Sounds like an acquisition.
we so with that question, we talk about all the innovation, and then it's interesting because the portfolio that you just mentioned is very diverse. It's not just diagnostics, it's not just it's not just lab diagnostics, it's not just imaging, it's all kinds of angle. What is your strategic vision of the company, and how did you formulate it that our company focuses on X? Like, what does that look like? I'm just interested from the sort of executive management and just strategic. How do you drop it through the layers of the organization and everybody is aligned behind this with a diversity like that in portfolio? What is the North Star for the company?
So I'd like to think that if you asked anyone that's at Zomedica, they would tell you the same thing, which is that we are focused and oriented around the vet and the pets that they treat. And so that introduction that I gave is that we offer innovative technology that improves the quality of care and the satisfaction of the pet parent, and the workflow, cash flow, and profitability of the practice. Those are the things that we orient around. We're not disease state specific. We're not technology specific. Rather, we look for things that really can have an impact on that veterinarian's practice.
That's fascinating. I mean, it's interesting because both me and Ivan have used this operating system called Traction to run our companies. Ivan introduced it to me, and there's an element of Traction, which are your three uniques. It sounds very familiar to us, the way you describe the vision of the company and also the things that make you guys unique. Where is Zomedica going in the next 5 years? What's the company going to look like 5 years from now?
So that's a great question. I started with the company in October of 2021, and we had just launched the TrueForma diagnostic platform. We had a significant amount of capital, but we really had, at that point, no sales, and the company was little more than a startup in terms of personnel and so on and so forth. Since then, we've made a number of acquisitions, and we made a lot of those within the first 18 months. And this year, we're really focusing on execution, on getting those products out. For example, we acquired the microscope, the company that developed the microscope, and it was good. It was very good, but it was one unit and then a separate computer with a monitor, and it didn't have a feature that we've added. And so rather than just put it on the market, we've spent almost a year. We put all of the components into one unit, has a very small footprint, has a monitor on it that they can utilize. And we also incorporated some technology that's called a liquid lens. Now, a liquid lens, you can get that on a human health microscope that costs over $100,000. But other than that, they're not available, and they're certainly not available in animal health. And what that liquid lens does is it very, very rapidly, in sort of milliseconds, focuses on every layer in the slide so that when you see the image, it's almost 3D. When you think about a slide, you have cells on top of cells on top of cells. And if you're doing it manually, you have to go to each level and focus to get all those layers in focus. The liquid lens does that for you right off the bat. So we look for products that have a great potential, that potentially are at an inflection point in terms of their ability to be brought to market. And then we've assembled a very robust sales and marketing team with multiple channels to market. We call it omnichannel. And we're not done yet, right? This year, we're really about deploying these devices and finalizing a couple of acquisitions. And then in the years to come, we still have an abundance of capital, and we expect to continue to acquire new technologies and to expand on those that we have. So 5 years from now, we went from no revenue in 2020 to 4 million in 21 to 19 million last year. So we're hoping that we continue on that trajectory.
That's a very good trajectory and very interesting. With that diversity in the portfolio, I'm just wondering, like, how's your business development team is focusing on finding the products to join the company or technologies that will fit the strategy. I mean, it's just so interesting that this is. I worked with MWI before when they invested into my previous company. It was very interesting. I worked a lot with business development because they will go and look at anything on the floor at exhibit shows. And I was always wondering, how do they actually pick and say, okay, we want to be a part of this? And other than listening to Veterinary Innovation Podcast, which would be a great source of startups and entrepreneurs, what is the other source of innovation that you target your business development people to look for the innovation?
So, first of all, there are a lot of innovative technologies out there, and deal flow hasn't been really an issue for us. We turned down a whole lot of things. We have narrowed our focus. We're not in the food business. We're not in the drug business, and we're not in the production animal business. So we're really focused on companion animals, be they dogs, cats, or horses. And we look for products that first meet those initial criteria. Do we think that this will really improve the situation for veterinarians? Is it going to improve the quality of care? And is there clinical data to back it? I come from human health. Getting clinical data before you launch something it's in my DNA, and we brought that here to Zomedica. So everything we have is backed by robust clinical data. So does it truly improve the quality of care for the pet? Is it backed by clinical data? And then does it have a positive impact on their practice economics? Does it improve their workflow? Does it improve their financial situation? And those are what we call our 5 pillars, right? And if it meets those 5 pillars, then we're ready to look at it. In terms of where they come from, one of our companies, the first acquisition, PulseVet, they were backed by a private equity firm. They had done a really great job in equine sports medicine, becoming the standard of care. But they were ready to get into small animals, but they didn't really have the financial backing to do it. So that being that they were at an inflection point made sense for us. We gave the resources. Small animal sales are up 400% last year. I mean, it's really very nice uptake and adoption in small animals. With the MicroView, the microscope, this was a small company that had been bootstrapped by the founder, and they had a great product, but just didn't have the resources to be able to get it to market. And so whether it's a human health company that has technology that we can spin off into vet health or animal health, or it's a small startup company that's looking to really get into the marketplace, this is where we find most of our acquisitions.
It's so fascinating, Larry, like listening to you speak and just knowing the wealth of knowledge that you bring to this industry from human health. One of the things that always strikes me, when it comes to products and innovation and launching products and selling them, is how much people discount that sales and marketing part of the equation. I've been involved with technology for years, and at one point I was working with Google directly. We were competing against Microsoft. We had a much better product, but Microsoft totally kicked Google's butt. How do you guys ensure that these companies that you acquire, how do you get from it's a great product to it's a great product that has a lot of customers?
So that's the question, right? So we were fortunate to be well capitalized, and I have a background in sales and marketing. And the first thing I figured out was I needed to hire somebody really good in marketing that knew the animal health industry super well and was well connected and could build a team and could orchestrate our efforts. And so that's why I hired Nicole Westfall, who's listening in today. Kudos to her. The founding CEO of PulseVet, who had built that business in the equine space, became our vice president of sales. He stayed with the company. The founding CEO of MicroView, or Revo Squared, which had the microscope, is now running our imaging area. And of course, Nicole, we also acquired a CC, and she had been the head of marketing at that company as well. Because we had the capital, we went ahead and built the omnichannel structure, in some cases by ourselves, in other cases by acquisition. So with a CC had relationships with all of the U.S. animal health distributors. So we acquired those. We have 2 different networks of international distributors we acquired from PulseVet and a CC. We acquired those. We built our own field sales organization, about 30 reps right now, 4 regional managers, 2 of whom were national sales managers at animal health companies before. So we've got a lot of talent there because they know we're growing, and there's going to be opportunities for them to grow as we move forward. We also have, through a CC, outlets through Chewy and Amazon and Walmart and Amazon. So our goal is to be able to sell products to veterinarians, to pet parents, however they want to buy it. Do you want to go through a distributor? Great. Do you want to buy it online? Super. We'll never undercut the price that the vet can charge, but we'll make it convenient for you. And so the other part of it is A lot of our products are completely proprietary. Like we have the only diagnostic assay for feline TSH anywhere. We have the only point of care assay for endogenous ACTH, for free T4, for quantitative cortisol. But some of these, since they weren't available, you have to do some education. And that's where Nicole's team comes in. We went to 80 some trade shows or events last year. We already have sort of the booth set up that we made big enough so that we could put multiple products through it. We have speakers lined up at all of the major shows so that we can have people on the podium that have experience with the products talk to other vets about those products. And to date, that's worked pretty well. We've been pretty happy with it, and of course, we'll continue going forward.
Sounds like a super duper simple plan to execute.
I always quote the book that I didn't know when in my first startup, I didn't know what the CEO job is. So I read the book, what CEO does, because I technically was the CEO, but I didn't know what my job description is. So in that book, it was a long and boring book. I remember two things: make sure that there's money in the bank, and then there's best people in the company that are hired. Two jobs. If you can keep that, then
I actually agree with that. I guess one other thing what I would add, which is to articulate a vision that everyone understands and can repeat in their own words and believe in. Even if the vision isn't exactly right, and believe me, we all have times where we need to change our perspective and tweak it this way or that way. As long as everyone's pulling in the same direction, then you've got a company that even if you need to change, you can change on a dime. And frankly, that's one of the things about animal health that I appreciate, in that while the FDA is certainly concerned about the health of animals, and if you put a product out there that didn't work or was a problem for animals, the FDA would get involved. But other than that, we don't have any pre-market requirements from the FDA, which means we can turn on a dime. If we see something that we need to do differently or would be better if we did differently, we can get that improved product or that improved feature out right away.
Makes sense. Well, we ran out of time as we usually do. It's been an interesting and wonderful conversation. Larry, thank you so much for finding the time. You're a busy guy. And we asked two questions at the end. So the first one is there a book, YouTube video, TED Talk, anything that inspired you recently that you would like to suggest to our listeners?
So I'm going to go with the anything, right? So my time in animal health dates back to October of 2021. A lot of years in human health. First time in animal health. So the first thing I did was I went out and I rode with people in the field and visited veterinarians in their natural habitat, if you will, in their offices. It's one thing at a trade show, but when you go in their offices and you see what's going on, and I was just inspired and motivated by the passion that these people have, by their sort of humble approach to what they do every day. And to me, that was motivating and inspiring, better than any book or any TED Talk. And there's good TED Talks, but really being able to see how these vets really care about their profession.
That's awesome. So, Larry, last question for you, and then we promise we'll let you go, because we'd like to talk to you all day. This has been a fun conversation so far. Last one is another innovator, somebody that's doing cool things inside the animal health industry that you think we should have on the show.
I'll tell you, I think there's a Dr. Bo Whitaker. Bo Whitaker is an equine veterinarian, and right now he's finishing up one study using the PulseVet device. He has experience with a condition called bleeders, which barrel racing horses often encounter. And he suspected that shockwave, which had previously been thought not to be a good idea to use on the lungs of a horse, but there was enough anecdotal evidence from a safety perspective to try it. He tried it, and he saw really good results. He's presented some of those results on an interim basis already, although the study is continuing through its endpoint. And then what he found as a result of all that was that, I think that we're treating effectively the bleeders by treating the underlying asthma. And so he's about to kick off a study now to determine whether or not the sound wave can actually improve or cure asthma in horses. And so I think he's a terrific example of someone who, isn't just using the tools, but figuring out how they might be of use in other areas. So he's one. And then the other one, I think Dr. Adam Chrisman, who I'm sure you're aware of, is really super knowledgeable. And I think the role of the educator, the role of of the person that can take the technology and then distill it down to what its real application is on a local mainstream level and present that to those veterinarians, I think he would always be a good choice to talk to.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.